There's a lot of confusion for lots of people. So I thought I would just do a bit of simple talking about testosterone and then talk about, progesterone, and then talk about progesterone intolerance. Now, I have done a YouTube before about progesterone, so it is worth having a look at that. You'll see from my background, I'm not at home today. I'm in Yorkshire, which is lovely, apart from it's absolutely pouring with rain. Anyhow, progesterone is a really important but actually quite neglected and misunderstood hormone. When we talk about hormones, obviously hormones are chemical messengers that go into our bloodstream and affect every single cell, organ, tissue in our body. And the hormones that we talk about are estradiol, progesterone, testosterone. Now, when I was taught not very much about hormones, these three hormones, I was taught estrogen is the important hormone and progesterone is only needed if women have a womb to protect the lining of the womb. And all the research in the past has always been done on the lining of the womb because it's all about whether a woman is pregnant or not, or whether she can get pregnant or not, or whether she's bleeding or not, or whether we have heavy, painful periods. And obviously these things are really important, but also so are the other organs and tissues in our body. And it's not just about how our womb functions, it's about how our brain functions, how our heart functions, our bones, our musculoskeletal system, our bowel, our bladder, every organ and system in our body needs to function. And hormones don't just select out the womb. Every organ in our body responds to progesterone. And progesterone is a hormone that is made in our ovaries, it's also made in our adrenal glands, and it's also made in our brains. It's made also in bones, it's made in lots of tissues in our body. And it's a very, very important hormone because our other hormones are actually made from it. So progesterone forms testosterone and estradiol, and it also forms cortisol as well, which is a really important anti-inflammatory stress hormone, if you like. So it doesn't make sense that the only reason people take progesterone is for their womb, because whether we have a womb or not, we still have other organs in our and tissues in our body that respond to progesterone. So the first real myth about progesterone, when we think about replacing hormones, giving people HRT, hormone replacement therapy, or menopause hormone treatment, MHT, or hormones for perimenopause or for PMS, PMDD, or postnatal depression, we need to be thinking about why we're giving progesterone. Well, firstly, we're not just giving it for the womb. Obviously, when we give it for the womb, it can help the womb be thin and reduce bleeding, but it does so much more than that. So when we give progesterone, we give it as part of hormone replacement. So regardless of if a woman has had a hysterectomy or not, or whether she has a Mirena coil in situ or not, she may still benefit from progesterone. And increasingly, we hear from women in our clinic time and time again who have really been transformed with having progesterone added into their HRT. And this is something I didn't even think about a few years ago because I didn't have the knowledge nor the vast clinical experience to piece the two together really and be working with patients to consider progesterone. So when we think about progesterone, there are different types, and this is really, really key. If you only learn one thing about this in this YouTube, just know that when people talk about progesterone, they're not always talking about progesterone. So progesterone, if you're going to be really pure with your language, which we should be, progesterone is the hormone that we produce as women when we're younger. We can actually prescribe progesterone, which is the same molecular structure as the progesterone we all produce when we're younger. And that should be the only way we call it progesterone. And there are different ways of having it. People can have it orally as a capsule. In the UK, it's often referred to as Utrogestan, is the trade name, but it's called micronized progesterone. And the micronized bit means that it's sort of been ground up small and suspended in some oil so it can be absorbed in the body. Because one of the big problems about progesterone when it was first discovered was that they had to give it by injection because it wasn't absorbed well into the body. So progesterone can be given as an oral capsule or it can be given as a pessary. And so in the UK, we often use Cyclogest as a trade name. And that is a progesterone, pure progesterone pessary, which can be used either vaginally or rectally. The same pessary, you can either insert it in the vagina or the rectum. There is also a progesterone cream. Now, there isn't a licensed preparation for progesterone cream, but some people get it compounded or you can buy it. But what we don't know is how, because it's not regulated, different companies produce different amounts, and it also the cream, we don't know what is in the cream as well. So you have to be careful when you're having progesterone cream. But they are the only ways of having progesterone. So when people talk about progesterone and progesterone intolerance, often they're not actually talking about progesterone, they're talking about a progestogen. Now, a progestogen is a synthetic progesterone, and there are a lot of ones. So when they first found progesterone, discovered it in the 1930s, they wanted to make a chemical structure that was different so they could market and sell it. And over the last 80, 90 years, drug companies have made different types of synthetic progestogens. So every contraceptive pill that's a combination pill with estrogen and progestogen is a synthetic progestogen. Every coil that's a hormonal coil is a synthetic progestogen. Every type of combination HRT, so whether that's a combination tablet or a combination patch, the combination bit is the progestogen bit is a progestogen, it's synthetic. When we look at even the risks of HRT, the risks are associated with the synthetic progestogen. So this is a chemical form of unnatural progesterone. And this is really crucially important because so many women I see in my clinic say to me, do you know what, I'm intolerant of progesterone. And when I talk to them, it's because they've had the progestogen only pill. But it's a nightmare because it's referred to as the progesterone only pill. It's not progesterone. And even if you go on some websites led by learned people, they talk about there being no clot risk with the progesterone only pill. That's not true because it's a progestogen, a synthetic progesterone, which does have risks. Now, the risks are only small, and if people are young and otherwise fit and well, then the risks are small, but there are risks. So there are risks of clot and stroke and heart attacks, and even the cancer risk has only really been shown with the synthetic progestogens, including the types of progestogen that are in contraceptive pills and the coils and the implants as well, and the injection, the Depo-Provera. But a lot of people think that's progesterone and it isn't. So when we're thinking about progesterone intolerance, we have to be very clear as doctors when we're asking patients, but also as patients ourselves. Are we intolerant of a synthetic progestogen, or are we intolerant of progesterone, our own hormone? And actually the former is far more common. Far more people are sensitive and intolerant to this synthetic progestogen. And so some people, lots of women actually change to different types of contraception because one doesn't suit. And they might find a different type of progestogen that does suit them. But they still have risks and they're more likely to have side effects. And a lot of side effects are ones that affect our mental health. So a lot of people feel quite low, they feel tearful, they feel moody, they feel irritable. They also might get bloating, they might get breast tenderness, they might get swelling of the legs with this fluid retention, they might feel that they've put on weight, they might get some pains in their legs. And these are very common symptoms related to progestogen, synthetic progesterone intolerance. And it not always is related to dose, so it can just really vary on people's response. But we know even the synthetic coils, so like the Marina coil or the Jades in the UK, we know that some of it gets absorbed through the bloodstream into the rest of the body. And so it's not unusual for people who've had a Mirena coil to get some of these side effects, and they're often dismissed and told, oh, it can't be due to your coil because it only works in the womb. Well, the womb has a very good blood supply, and so the synthetic hormone getting into the blood supply can affect the brain and the rest of the body, so can lead to side effects. So we have to be really careful when we're working out, when we're giving hormones to people. So if a woman is needing HRT and wanting to take HRT, then obviously we usually prescribe the estrogen as estradiol, the natural estrogen, and that's usually through the skin as a patch or a gel, or sometimes we give it as a tablet. And then I always usually prescribe the estrogen and progesterone separately, so I can control the dose of each very well. And like I say, any combination tablet or patch contains the synthetic progestogen. And I don't tend to prescribe the synthetic progestogen because I feel very strongly as a doctor, if there's a safer alternative, we should be providing that first for patients. So I will reserve the synthetic progestogens to women who don't respond or improve with the natural progesterone. So some women will say, well, I still have side effects. I don't like when I take it orally. It makes me feel quite drowsy. It makes me feel tired. It makes me feel irritable, or so forth. They might have other side effects as well. Now, what happens when we take something orally is that it goes obviously in our mouth into our gastrointestinal system, and then it gets absorbed through the liver. And our liver is like a filter, if you like. Anything food or drink that we put in our mouths, it goes through into the bloodstream, but it goes through the liver, and the liver detoxifies really. So it will pick out anything that isn't natural, or it will try and make it as natural as possible. It will break things down so then it can get absorbed to the rest of the body as cleanly as possible. But when the progesterone gets absorbed orally or taken in orally, it gets metabolized to different types of progesterone. And some of those types are good because they can make people feel a bit drowsy when they go into the brain. And people can often sleep, and they find it a nice side effect because they can sleep better when they take progesterone. But some people don't like it, and they do have some side effects. And that's where thinking about, rather than saying you can't have progesterone, you're intolerant, thinking about a different formulation. So sometimes with women, we'll suggest having it as a pessary, like I say, vaginally or rectally instead. And the advantage of doing that is it gets absorbed straight through the blood into the bloodstream. If you can imagine, in the vagina and the rectum, there's lots of blood cells. So it's putting it there means that it gets absorbed through the mucous membranes straight into the bloodstream, where it stays as progesterone. It doesn't get metabolized in through the liver in the same way. So it stays as the pure progesterone. And a lot of people find having that shift can really make a difference. And there is a difference whether you use the oral capsule off license vaginally, or you use the actual pessary, say, of something like Cyclogest, because they are different. The capsule is a gel-filled capsule, and sometimes when it melts in the warmth of the vagina, people can get quite a sort of spurt of progesterone and a peak quite quickly. Whereas the pessaries are more waxy, so they have a slow release, so a steady state of progesterone. And as you know, some women are very sensitive to changing hormone levels. So if you have this big change of progesterone suddenly getting into the body, it can trigger symptoms. Whereas if it's a slow release, steady state, it's easier. Now, paradoxically, some people are better with a higher dose of progesterone than others. And if you remember, or if any of you have listened to me talk before about levels of hormones throughout the menstrual cycle, actually we produce a lot more progesterone than estradiol. And so doses of progesterone often are needed a lot higher than we prescribe. And Dr. Katrina Dalton in the 60s, 70s and 80s really discovered this with women. And she was using doses of up to 1,000 milligrams as a pessary. And often we start at 200 milligrams. So meaning that some women might need 2, 3, 4, 5 times more than that dose. And that's important to stimulate the receptors properly. Because if we have low hormones, it can be as bad as not having the hormones at all. It can change the way our immune cells work, and it can change the way the function of our cells work as well. So some people, if they have it as a pessary and then they come back and say, oh, I don't feel right, that really doesn't suit me, we actually increase the dose sometimes for some women, and that might sound a bit paradoxical, but we have to also remember that progesterone is very short acting. It only lasts a few hours at most in the body. So often with people, I'll say, just try and have confidence in me. Let's increase the dose, and you'll know within a few days whether it's helping or not. And that is really useful for people to know. And often after a few days, they feel so much better, because if they have the right amount of progesterone, then it's easier to form all the other hormones in the body as well. And it really is such a master hormone, not just for our sex hormones, testosterone and estradiol, but also for inflammation and stress as well. It really balances out. And a lot of people are trying so hard, thinking about their adrenal gland, thinking about their stress, and they're not thinking about their progesterone. And so having that solid progesterone hormone, having it absorbed as pure progesterone, thinking of it as using it as a pessary. And some people find that they get it absorbed better when it's a rectal pessary than a vaginal pessary. And that's because we've got more blood supply around there, it's more active. And also if people are having some symptoms, they're more likely to have vaginal dryness as well, which means there's less blood supply in and around the vagina too. So using it rectally is actually quite good. It's just in England, we don't often give things as a pessary. We usually give them, give tablets a lot more commonly. But in the continent, especially in France, they're very used to pessaries. It's a great way of having a drug because it bypasses the liver as well, like I've said. So it's just something to think about. We need to make sure that it's the balance of hormones that's really important too, because a lot of people contact me and they think they're intolerant of progesterone, but then they're on a really low dose of estradiol and they're not on any testosterone. And so they're sort of blaming the progesterone, but actually it might not be the progesterone. It might be that they need a different dose of estradiol and they might need testosterone as well. And that's really, really important to consider. The other thing is that some people can become progesterone intolerant when they're perimenopausal. Now, when we're perimenopausal, we're still producing hormones. And as you know, our hormones really fluctuate during perimenopause, which means there are some times that we'll have very high levels of progesterone naturally in our body. And you can imagine if then you're taking progesterone and you're producing a high amount of progesterone, it's like your body's going, oh my goodness, what's going on? It's quite a roller coaster. And so sometimes if people are still having regular periods, we might just give the testosterone and estradiol and pause a bit on the progesterone and wait until periods are changing and then add it in, and people tolerate it a lot better. So it's very individualized. Everything with hormonal treatment, like anything in medicine, is very individualized. And it's important that people realize that, because otherwise they might go, right, I had such an awful experience, I never want it again. And then they're missing out on the benefits of having progesterone. And progesterone can be very calming. It can really help with anxiety, it can help with mood, it can help with brain function, but it also can help our cardiovascular system, can help our bones to be strong as well. So it is important to consider for many of us. One of the problems with Cyclogest is that privately it's expensive. It's used as a fertility drug as well, and anything with fertility seems to have a price label on it. And it's a real shame because it was becoming very popular in the sort of 60s and 70s, and then they started to be scared about hormones, and they also started to manufacture a lot of synthetic progestogens, and so all the money went into the drug companies making new drugs for contraception, and they forgot about progesterone as being a very important hormone for women and women's mental and physical health. But also it can really help with bleeding. So if people have a lot of bleeding for whatever cause, maybe it's because of their periods, maybe it's because they're on HRT and it's a side effect, then using progesterone as a pessary, especially actually rectally, can really reduce that bleeding. The other thing to mention is that when people are perimenopausal, we usually give the progesterone for 2 out of 4 weeks to regulate periods. And for people who are very sensitive to progesterone, they might find it better if they just have the progesterone throughout the cycle, so one each night, either as orally or rectally, and then the body is getting the same every day, and that's fine. Sometimes people might just have more irregular periods rather than having regular periods, but eventually the periods usually settle. But if you feel better mentally and physically, most of us can cope with some irregular periods. Now I'm going to put my glasses on because I can see that there's some questions. So thank you so much for asking questions. So I'm just going to go to the live stream chat and see, so I can whiz through in the next 10 minutes some questions. I keep bleeding on 200 cyclodest. Should I increase? Can't have Marina. Now, obviously, I can't give individual answers, but quite often we will increase the dose and we'll often suggest having it rectally than vaginally, and that can be really helpful. And some people only need like a higher dose just for a few days to get on top of the bleeding and then go back down to the other dose that went before. Chucking it down in Leeds, yeah, great. It was nice on Friday though, I must say, the weather that is. Slightly off topic, is it true that progesterone suppresses not just growth of lining the room but other growth factors of the body? Not really suppresses growth factors. It's really important for growth factors, and that's why it's so important for the bone and the heart as well. It's very anti-inflammatory. It's a very, very beneficial hormone that's been neglected, and lots of doctors, and I didn't either, but lots of doctors don't understand how important it is. Should you suggest me taking food on an empty stomach? Right, this is really confusing, isn't it? If you look at the manufacturers, they'll say to have it on an empty stomach. Now, the only reason they say that is because the absorption can increase if you have it when you've got food in your stomach. But does it matter because it's a safe hormone? And actually, some people want to have a higher level just because it can help them more. When you look at Bijuve, which is a combination of estradiol and progesterone, it doesn't say about an empty stomach. So, and the evidence actually is very scanty. I would actually just take it when you remember, because some people, if they do shift work or they have a snack before they go to sleep, they're not taking it. So I would just take it when it works for you. So I wouldn't worry too much about it. Had a marina coil fitted. My body seems to be craving progesterone. Yeah, absolutely. So some people who have the marina coil, when they have the marina coil, some of it, like I say, does get absorbed into the bloodstream and to the rest of the body, and it will block the progesterone receptors. If we have natural progesterone as well, what we want to do is get the natural progesterone stimulating the receptors, helping the cells and body to work. And that's why often we will give progesterone as well as the marina. There seem to be some doctors who really don't want people to prescribe it. I don't understand why. It's just a natural hormone. It's very safe. So increasingly, like I say, women who want to try progesterone and see if it helps their symptoms when they've got a marina, it's absolutely fine to do. Vagina, but a lot of urine. I don't really know what they're saying. The difference of rectal. Well, I've explained the difference between vaginal and rectal, really. Same benefits, absolutely. The benefits, regardless of whether you put it in your mouth, your vagina, or your rectum, are still there. But like I say, it just gets metabolized differently. I've had postmenopausal bleeding for several months. About to do the coil. One last thing. Started to take progesterone at night and it fixed it. Yeah, I mean, I think we just need to be a bit bolder with progesterone to help with bleeding, actually, rather than just going for marina coil for everybody. I've had my Everil Sequi patch increased. My GP wants to add additional progesterone. Is it necessary? It's really difficult. So progesterone, proper progesterone, doesn't get absorbed through the skin very well and easily, but the synthetic progestogens do, and I'm hesitating because the studies really aren't very good. The Everil Sequi, Everil Conti contain a synthetic progestogen. I would always try and change my patients to having the natural progesterone first off anyway. So I would give a pure Everil patch with only estradiol and the natural progesterone, and then you know what you're doing. But like I've said before, if you increase the dose of estradiol, it's usually because people need it to be absorbed through the skin. You don't knee-jerk have to increase the dose of progesterone. The guidelines that do say you have to isn't based on any solid evidence. I've tried oral vaginal progesterone and 2 progestogens, could not tolerate them. Prometrium was the first. Estrogen patch has been fine alone. History of PMDD. Now, I do have a very small number of people who just can't tolerate any progesterone at all. And so some people, like I say, are on estrogen and testosterone. Those women, we worry about the lining of the womb, whether it builds up at all, but not everybody on estradiol has problems with their lining of the womb. So usually we just do regular scans on people. If they have bleeding, we do scans more frequently, but we do scans at least every year to have a look and see. And if someone has just become menopausal or they're perimenopausal, they might still be producing some progesterone anyway. So then I might wait a few months and then try and reintroduce the progesterone as well. So this is why it's really important to be under constant review by people that understand. I've been told I'm progesterone sensitive, so I'm on Nutrogestone, but pain from adenomyosis is getting worse. So I have spoken about adenomyosis and endometriosis. I think it's really important to have adequate testosterone as well, because it's very anti-inflammatory. It can help with some of those symptoms, and then maybe trying progesterone as a pessary can help as well, because a combination of testosterone and progesterone can be very useful for people with adenomyosis and endometriosis. Only thoughts of Femiston. Femistan's okay, but it contains a synthetic progestogen. When you look at the studies for breast cancer, it does seem to be the most breast neutral when it comes to taking it compared to the other synthetic progestogens. Probably has less side effects as well. So I've got some patients who like it. It's quite a low dose of estradiol, and so sometimes people need a little bit more estradiol and obviously testosterone separately as well. Speak to the issue of down-regulating the estrogen receptors, which some experts not a good thing. Yeah, I mean, a lot of it is we don't know, because the studies really haven't been done very robustly. Some people think that you should still have a break of progesterone because of the way that the receptors work and need to be down-regulated, and especially in the brain. It's really difficult, isn't it? Evolutionarily, we're designed to be pregnant a lot of our fertile life, and then we have very high levels of estradiol, progesterone in our bodies, and that's sort of increases and then sort of stays high for quite a long time. So we don't really know. We're not sort of designed to have periods every month. Some people feel better, though, to having a few days off. They might have a few days off a month, or they might have a few days off every 2 or 3 months. And this is where individualization of care is crucially important. A lot of my work is very general when I educate like this, whereas in the consultation room, it will be very, very individual. So just giving people a feel, but also knowing that there are choices is really important. So if someone is having some symptoms and feels that they want to have a break for a few days and they find that that's good for them, then that's fine as well. We don't need to work out of rigid textbooks when we're thinking individually for women. What are the signs of intolerance? I've mentioned that. I have a soy allergy. What's the best alternative? So you can use Cyclogest, so you can use the pessaries as well. Thanks to your work, I've been cycling HRT for PMDD for the last 4 months. It's been life-changing. Brilliant. Really good. My body was screaming for help. It's finally getting to help. Thank you. Good. I'm really pleased. So yeah, somebody's saying you got side effects, puffed up, fluid retention. And again, that can be worse with oral progesterone and maybe change. And like I say, some people do have through the skin progesterone. I wouldn't recommend having through the skin progesterone to protect the lining of the womb. But say, for example, someone's had a Mirena coil or they've had a hysterectomy, then some people think about having the progesterone through the skin just to see if that helps. Like I say, there's always options. Someone's asking, can you give contact details? Just contact through my Dr. Louise Newson.co.uk website. It's the easiest way of getting hold of me. What happens if you can't tolerate? Well, that's really important, seeing someone who understands. And I have gone through some of this already. I'm just conscious of the time. A lot of these are similar to things I've asked. Zambia, great. It's really good to have people from all over the world, isn't it? I'm 41, I've regular periods, awful mental health in luteal phase. I'm surprised you said you would start some with regular periods on estradiol and testosterone before progesterone. Well, I said for some people, if you're having really bad symptoms in the luteal phase, then it's probably more likely to do to progesterone. So sometimes with people with really bad PMS or PMDD, then I might start the progesterone in the second half of the cycle when they're getting symptoms, but then I'll often do estradiol and testosterone levels as well, because sometimes, quite often really, people need all three hormones. When we start to decline our progesterone is often before estradiol, but testosterone can decline as early as the late 20s, early 30s. So it's having a combination sometimes. But I've got some patients with PMDD who just have progesterone for a few days, either orally or as a pessary, and it's absolutely transformational. So everyone's different. I'm having Everol Conti and progesterone every 14 days. You probably don't need to have the Conti bit. I would just stop it really, because I don't understand why you'd have a synthetic progesterone unless you don't need it. Can I use Geloplex rectally or vaginally? Yeah, off label, but if it works, yes. Slind, is it a safe form of progesterone? It's still a synthetic progesterone. The irony about all these synthetic progesterones is there's very, very little evidence about the benefits or risks to the rest of our body and tissues and organs, but they don't stimulate the receptor in the same way as our natural hormones. So I'm just, what's the point of having something synthetic if you don't have to? It's like eating processed foods. If you don't have to, don't have them. Every time I try to use Nutricist, I'm distraught. I've had a hysterectomy. I'm okay for 3 weeks. So it really depends. Looking at the balance of the other hormones again is really, really important as well. And then looking at other things too. We'll always look about what supplements people are taking, what their lifestyle's like, exercise, other factors, because all of these can impact hormones as well. Let's have a look if there's anything else. No, I think that's most of the ones actually from the chat on here. I've had loads of messages on my Instagram and I haven't got time to go through them, but all these questions are really good because it can help me shape future content as well. But if you've got ideas for more content, please let me know, either as these YouTubes or future podcasts, or we're thinking about other ways of getting more information out as well, because the more I read and understand, the more I want to share with you, because there's been so much misinformation for so many years, and there are still lots of people who are giving the wrong information that isn't based on evidence or science. And just to remind you, I do no work with pharmaceutical companies, so I don't have another agenda. My agenda and mission is to improve the health of women by allowing them to have choices and information so they can make choices that are right for them. So I hope that's been useful. I hope for those of you who are up near Yorkshire, the rain stops. I'm desperate to go out for a walk tonight, and enjoy the rest of your evening, and share this link with friends and colleagues and relatives, and just get them to think more about hormones and the difference between natural and synthetic hormones. So thanks again for your support.